Many people smoke cigarettes or use drugs often without fully understanding the risks involved. They might think it makes them look cool, help them relax, or fit in with their peers. The social aspect can be very influential. But smoking and drug use are very dangerous, with consequences that far outweigh any perceived benefits. They can hurt your body in many ways, both now and in the future. The damage can be both immediate and long-term. It's important to know the risks so you can make healthy choices. Education and awareness are key to prevention. Smoking and drug use are harmful because they contain dangerous chemicals. These substances are not just harmful, they are toxic. These chemicals get into your body and start to cause damage right away. The impact can be felt almost immediately. Over time, this damage can lead to serious health problems, even death. Chronic illnesses and life-threatening conditions are common. It's easy to think that trying cigarettes or drugs once won't hurt. The temptation can be strong, especially in social settings. But even one time can be harmful. The first use can start a dangerous path. And the more you use these substances, the more damage you do to your body. The effects are cumulative and can be devastating. The good news is that it's never too late to quit and start living a healthier life. Recovery and positive lifestyle changes are always possible. When you smoke a cigarette, you probably notice some effects right away. You might cough because the smoke irritates your throat. You might also get a headache or feel dizzy. This is your body's way of telling you that something is wrong. Smoking also makes it harder to breathe. That's because the smoke damages your lungs and makes it difficult for them to get oxygen to your body. You might feel out of breath easily, especially when you exercise. Another immediate effect of smoking is bad breath. The smoke leaves a bad smell in your mouth that can be hard to get rid of. Smoking also stains your teeth yellow, making you look older than you are. The short-term effects of smoking are bad enough, but the long-term effects are even worse. Over time, smoking damages almost every organ in your body, leading to serious health problems. One of the most well-known long-term effects of smoking is lung cancer. Smoking is the leading cause of lung cancer, which is a very serious and often deadly disease. Smoking also causes other types of cancer, including cancer of the mouth, throat, bladder, and kidneys. It can also lead to heart disease, stroke, diabetes, and other serious health problems. Section 4. The lungs, under attack from smoke. The lungs are one of the organs most affected by smoking. When you inhale cigarette smoke, you're breathing in thousands of chemicals, many of them toxic. These chemicals irritate and inflame the delicate tissues of your lungs. Over time, this constant irritation and inflammation cause significant damage. The tiny air sacs in your lungs, called alveoli, lose their ability to expand and contract properly. This makes it harder to breathe and can lead to a chronic condition called emphysema. Smoking also paralyzes and even destroys the cilia in your lungs. Cilia are tiny hair-like structures that help to clean your lungs by sweeping away mucus and debris. Without functioning cilia, smokers are more susceptible to respiratory infections like bronchitis and pneumonia. Section 5. Beyond the lungs, smoking's toll on the heart and more. While the lungs are the primary target of cigarette smoke, its harmful effects extend far beyond the respiratory system. Smoking is a major risk factor for cardiovascular disease, which includes heart attacks, strokes, and peripheral artery disease. Nicotine, a highly addictive substance found in cigarettes, constricts blood vessels and increases blood pressure. This puts extra strain on the heart and damages the lining of blood vessels, making them more susceptible to plaque buildup. Smoking also increases the risk of developing type 2 diabetes. It does this by interfering with the body's ability to use insulin properly. Insulin is a hormone that regulates blood sugar levels. When the body doesn't use insulin effectively, blood sugar levels can rise to dangerously high levels. Section 6. The danger within. Understanding the risks of common drugs. Just like smoking, using drugs, whether legal or illegal, poses serious risks to your health. These substances can have immediate and long-term effects on your body and mind, often leading to severe health complications. Drugs are chemicals that alter the way your body and brain function. They can change your mood, perception, and behavior, sometimes in unpredictable ways. They can be addictive, meaning that you may crave them and find it difficult to stop using them, even if you want to. Addiction can take over your life, affecting your relationships, job, and overall well-being. Some common drugs include marijuana, cocaine, heroin, and methamphetamine. Each of these drugs has its own set of dangers and can lead to different health issues. Each drug has its own specific effects on the body, but all of them can lead to health problems. For instance, marijuana can affect your mental health, while cocaine can have severe cardiovascular effects. For example, marijuana can impair memory and concentration, making it difficult to perform daily tasks or succeed in school or work. While cocaine can cause heart attacks and strokes, which can be fatal or lead to long-term health issues, prescription drug abuse is also a growing problem. Many people misuse medications thinking they are safer than illegal drugs, but this is not the case. This involves taking prescription medications in a way other than prescribed by a doctor, such as taking higher doses or using them for non-medical reasons, or using someone else's prescription drugs, which can be extremely dangerous and lead to unexpected side effects or addiction. Abusing prescription drugs can be just as dangerous as using illegal drugs. It can lead to overdose, severe health issues, and even death. Always use medications as directed by a healthcare professional. Section 7. Choosing a healthier path. Tips for a life free from drugs and smoke. The good news is that it's never too late to quit smoking or using drugs and start living a healthier life. No matter how long you've been using, your body has an incredible ability to heal itself once you stop. The sooner you quit, the sooner your body can begin to repair the damage. Quitting can be tough, but it's possible, and the benefits are enormous. You'll start to feel better almost immediately, and over time your risk of serious health problems will decrease significantly. Here are some tips to help you quit. Make a plan. Decide on a date to quit and stick to it. Having a clear goal in mind can help you stay focused and motivated. Get support. Tell your friends and family that you're quitting and ask for their support. They can provide encouragement and help you stay accountable. Avoid triggers. Identify the things that make you want to smoke or use drugs and avoid them. This might mean steering clear of certain places or situations that you associate with smoking or drug use. Find healthy ways to cope with stress. Exercise, relaxation techniques, and spending time with loved ones can all help reduce stress. Engaging in activities that you enjoy can also keep your mind off cravings. Don't be afraid to ask for professional help. There are many resources available to help you quit, including counseling and medication. Professional support can provide you with the tools and strategies you need to succeed. Remember, quitting smoking or using drugs is one of the best things you can do for your health. The positive changes you'll experience will be well worth the effort. By choosing a healthier path, you're giving yourself the gift of a longer, happier, and more fulfilling life. Embrace the journey and celebrate each milestone along the way.